A rare and troubling case of malaria. Yeah, you heard me, malaria has been discovered right here in New Jersey in Morris County. And notably, the individual had no history of traveling internationally, raising some important public health questions. Joining us this morning to break down what this all means and how concerned we should all be is Dr. Steve Goldberg, who's the Chief Medical Officer at HealthTrackRx, also known as HealthTrackRx when you spell it out. It's the nation's leading infectious disease laboratory. We'll tell you 100 reasons why. Good morning to you first, Dr. Goldberg. Good to have you on.
And good morning to you.
And we had technical issues on our end yesterday, and I want to thank you for being so patient through this and for coming back today. We appreciate you very much, sir. We know you're busy. What do we know about this particular malaria case in Morris County? Do you have any details on it for us?
Yeah, well, someone presented with complaints of feeling ill and got evaluated, and there's evidence that they have malaria, but there was no international travel. And that's usually the source of US citizens getting malaria, about 2,000 cases a year. So it's a bit unusual. And checking this morning, there appears to be a second case in Seattle. Similar story, someone feeling ill, no international travel, getting checked and appears to have malaria. Two cases only so far in 2025, but it's not common.
Mhm. And of course, what malaria is passed by mosquitoes. A mosquito would take blood from someone infected, correct? And then if they go and sting somebody and they try to get blood from somebody else, that's how they could transmit the virus, correct?
Exactly. So the virus doesn't spread person to person, and it doesn't spread animal to person. What happens is that the parasite of malaria is in someone and they get bit by a mosquito, and then that mosquito bites someone else, and that's how they transfer the parasite.
And I'm gonna not put politics on you. I'll be the one doing it here. But I want people to just think, and this is not, we don't have any evidence for what I'm about to say, but I just want people and politicians to expand their brains for a minute. What have we done in the last 5 years? We've opened up the gates to tens of millions of people from countries where malaria is still active. Areas near the Amazon rainforest, etc., wherever you have standing pools of fresh water, etc. We allow in not a few thousand, but tens of millions. Many people who could have come over infected, not even knowing it. They get bit by the mosquito. The mosquito then goes 100 feet, bites somebody else who's just in their neighborhood. Boom, they get infected. I'm not saying that's what happened. We have no clue. What I just said could be totally false, but that is a scenario that could happen. Am I wrong or am I right?
Well, Ken, the way I think about it as a physician, we've got two cases, so we don't have a trend. And the way I think about it is that most US cases to date are when a US citizen travels abroad and comes back and gets diagnosed with malaria, about 2,000 cases. We have many more cases of West Nile spread by mosquito in the United States, far more than these two cases of malaria. So I put it in that type of context myself. And a couple other points. We need mosquitoes. Mosquitoes are in the
Mhm.
food chain that provide food for fish and other animals. Mosquitoes provide transfer of pollen, which is important for plant growth. With warming environments and opportunity to do better care around water that's stagnant, we can control the population and keep things in balance. So those are just a common things that I'd have people think about.
Well, and very valid, and I appreciate you clarifying. Doctor, I just want to go for a second and talk again about health tracks and how brilliant the idea is. You have your lab at the airport, right? So when people, when labs around the country collect blood samples and send them in, the reason why you're able to turn around the results so fast is literally what? The test kit comes off the plane, goes right there to the lab, gets tested, and the results get emailed out. Is that basically how it works?
It's a thing of beauty. Anywhere in the continental United States where someone presents in an ambulatory setting, that means urgent care, primary care, women's health, etc., who comes to the office and says, I don't feel well, I think I have an infection. You can use our testing and then the test gets picked up about 4 everywhere in the United States, flown overnight. Our team is working at night, and they result it out the next morning. It's a great strategic partnership with UPS, also anchored in Louisville, Kentucky.
So smart. It's so smart. And I mean, I know in the past, having been tested, sometimes it would take 3 days before you get the results, and you're on pins and needles the whole time. Here, to be able to find out overnight for your own health, your doctor being able to treat you and figure out how to treat you properly. You don't want to give somebody antibiotics if they don't have a bacterial infection, etc. I mean, this is just such a tool in the toolbox that is so good. And you guys, how many years has HealthTrack's been around now?
HealthTrackRx is a 20-year-old company, but we're growing at 35% per year. So it's really an exciting time for us. And to your point, antibiotics are overprescribed in the outpatient setting. And by using our testing, you can get a very specific explanation of why you're feeling ill. And clinicians tell us that that specific information allows them to be more selective with antibiotic use. And we're very proud of that.
Very good. And just to steer it back really quickly for because we talked about the malaria thing, the malaria issue. People hear that now they're going to be concerned, of course. So what is your message to viewers who may be hearing the word malaria and they get anxious and they worry, my gosh, it's here, we're going to get infected? It's the chances are very slim, right? So please let folks know how they could prevent getting infected and how the chances are not very high.
The chances are not very high. So, in general, what I would do at your home is if you're going outside, use spray that prevents mosquitoes from biting you. If you're going to be outside for a while and there are mosquitoes there, put up some netting. And then if you have still water sitting around your property, get rid of it. Doing those things should keep you in really good shape.
Excellent. And what's your website for Health Tracks? And it's spelled for everybody. It's Health Track RX, RX as in prescription. Give everybody your website, please.
www.healthtrackrx.com.
Excellent. What a great company. Dr. Steve Goldberg, Chief Medical Officer at HealthTrack's, HealthTrackRx. For all of you running urgent cares and doctors' offices around the country, check it out. If you haven't heard of it yet, you should have. Thank you so much for joining us this morning and for helping advance healthcare in a very positive way in this country. We appreciate you, sir.
Thank you, Ken. Have a great day.
You as well.